Hello everyone, my name is Asim Shrivastava and I am a PhD student at LCS2 Lab, IIIT Delhi. Today I will be presenting the paper titled Speaker and Time-Aware Joint Contextual Learning for Dialogue and Classification in Counseling Conversations. This work has been published at Wisdom 2022. Recently, during the pandemic, a high surge in the number of mental health patients was observed across the globe. On the contrary, many new dialogue agents came into the picture. Visa, Wobot, Inner House are some of the popular names in this domain. These assistants try to generate helpful responses by understanding various components of the patient. While we were into this research, we observed three crucial points. The patients are complex to understand, and it's quite obvious given their problems. A lot of efforts are being made towards the understanding of the patients. For example, patients generally suffer and a lot goes on in their mind. Understanding a patient directly from the utterance only is a challenging task. The therapist and the patient show certain characteristics specific to each speaker in the conversation. For example, therapists tend to ask a lot of questions, whereas patients generally answer those questions to deliver the information. These characteristics has shown to be useful in recognizing the dialogue acts of the utterance. We will discuss this in the further slides. Current conversational agents find understanding the user's intentions a difficult task in the counseling setting. For instance, recently a mental health chatbot completely failed in understanding a 14-year-old sexually abused boy and refused to deliver any kind of help, explaining the situation is safe with the boy. In this paper, we tackle the task of dialogue act classification, targeted for mental health-based counseling conversation. In the current highlighted section, you can see a sample counseling conversation where the therapist and the patient are discussing the drinking problem of the patient. These counseling sessions generally contain conversations from CBT, which is cognitive behavioral therapy, child therapy, family therapy, etc. We created a novel data set named HOPE. It is counseling-based conversation data set annotated with 12 different dialogue act labels. The data set can be used by researchers to propel the dialogue understanding research forward in many ways. To annotate the HOPE data set, we define a novel hierarchical annotation scheme for the dialogue act annotations. Further, we propose SPARTA, a novel time and speaker aware model to predict 1 out of 12 dialogue act labels. Let me quickly go through and formulate the task also. Our task is a classification task where for each utterance we predict 1 dialogue act label out of 12. On the screen, you can see a sample of dialogue with the corresponding dialogue act label. For this task, we propose HOPE dataset. The title HOPE stands for Mental Health Counseling of Patient Dataset. We annotated close to 13,000 utterances with 12 different dialogue act labels. On the screen, you can see the hierarchy tree for annotation scheme. As you can see, we took care of speaker initiative labels, speaker responsive labels, and some generic labels. Speaker initiative labels are the ones where the speaker drives the conversation for the next few utterances. Next is the speaker responsive labels. The dialogue act labels under this category are used in response to the speaker initiative labels. Apart from these specific labels, we observed utterances can also be categorized into some general category, composing of utterances tagged with general chit chat, greetings, or acknowledging, which is common in any conversation, irrespective of the task. If we talk about our methodology, our model is called SPARTA, which stands for Speaker and Time-Aware Contextual Transformer. On the screen, you can see the complete SPARTA model. This SPARTA model is divided into two major modules. The first one being a speaker aware module, and the second speaker invariant module, jointly trained to predict the dialogue act level. We mainly incorporated global context, local context, which we call memory cell, and then introduced time-aware attention. The motivation behind the dialogue act, the motivation behind the time-aware attention is that the recent past contextual utterance have higher significance than the distant past utterances. So unlike the standard attention mechanism, time-aware attention focuses more on the nearby utterances. In the speaker invariant module, you can see we deploy a memory cell, which basically looks into the nearby local context for past K utterances. We deploy GRUs to store global context and then calculate time-aware attention on top of that. Likewise, in the speaker-aware module, we use similar methodology, but this time we utilized Roberta transformer fine-tuned on the speaker labels. We fuse speaker-aware and speaker-invariant representations by concatenating them and pass them through classification layer to receive probability distribution for the 12 different dialogue act labels. Now let's take a look at the results section. Table on the screen is showcasing the performance of baseline models as compared with our SPARTA model. If we just have a look at the last, second, and third rows, we see our final model SPARTA with time-aware attention and multi-age attention meeting second best baseline. We observed more than 6% relative improvement over the next best baseline on all metrics, which is SASA. After that, we also visualize the speaker-aware and speaker-invariant utterance representations. We employ principal component analysis to project the representations into 2D. We can observe that the speaker-aware representations distinguishes between the patient's and therapist utterances pretty well. On the other hand, the patient and therapist utterances are mixed in speaker-invariant representation. We also did a comparative analysis to see confusion among the predicted labels. We see a very nice confusion matrix here on the right side of the screen. The model feels a little challenging differentiating utterances tagged information delivery and opinion delivery, which in general is confusing for human as well, but our model handles most of the labels very decently. To conclude the points, we curated Hope dataset for the dialogue act classification in mental health counseling space. We defined an annotation scheme with 12 dialogue act labels. We proposed SPARTA, a novel transformer-based speaker and time-aware joint contextual learning model for dialogue act classification. Experiments and analysis show the superiority of our model over baseline models. Thank you for attending the talk. If you have any questions or want to connect, please reach out to me at asweems@trippleitdelhi.ac.in. Thank you.